Here to speak next is Dr. Espinoza. He's an active neurosurgeon with specialization in functional surgery and the founder of the Latin American Institute of Neurology and Nervous Systems.
So thanks for the nice word and the invitation.
Thank you.
So it's my honor to be here and to speak in front of you. I am a neurosurgeon from background and the founder of ILANS, which is a network of neurological clinics about which I am about to talk a little bit about. And I am also the Vice President for Medical Affairs at Chiron. So I'm going to try to make a very long story short to talk in less than 15 minutes about the cannabis breakthrough in modern medicine. I know I'm not going to succeed, but I'm going to try to do my best. Really, not working. It doesn't. Okay, this is the contents of my talk. So, next. First of all, ILANS is a network of neurological institutes located at the moment in Bogota, Colombia, where patients receive interdisciplinary diagnosis and treatments of the disorders of the peripheral and central nervous system. Since its foundation by me 9 years ago, we've seen a steady growth in patients seen and in services offered to the patients. And we derive these big numbers of patients mostly because we have a system, the health system credibility. And this derives from the fact that our model is a patient-centered one. So patients matters us the most. And all these strategies that we develop are all aimed to improve the patient's quality of lives. So this is a truly patient-centered model. We also apply cost-effectiveness strategies that try to reduce the health cost burden to the healthcare system. And we also use innovative bundled programs in which we have included cannabis products to offer patients integral services and integral treatments. So in the right part of this slide, you see the number of patients we saw the last year, 2018. We saw almost 120,000 patients pertaining to different kind of clinics, many with dysfunctional clinics. We have there the sleep disorders clinic, the movement disorders clinic, and other clinics that gather doctors, nurses, and all of these members of these teams are highly specialized to provide the best standards of treatments to patients. This is the outlook of the specialized clinics at ILANS. So there are actually 60 doctors, specialists in neurospecialties working there, and supported by a team of 20 doctors, general physicians, nurses, and therapists. So to begin with the scope of this presentation, we have to talk a bit about the limitations of current therapies. For one part, I want to introduce you to a medical term for those of you who are not doctors, and it is called medical refractoriness. This equates, or is the same as, treatments are no longer effective in patients. This might happen out of any of these two situations, either because by increasing the dosages of the medications, patients do not get an improvement, or because when doing that, when increasing the dosages, the patients are plagued by adverse effects that limit further increases in the dosages. So one way or another, medical refractoriness is high among the various illnesses and treatment regimes. No, go back. So the other limitation in current treatments is the way we, as of now, address the disability in patients. There is frequently a mismatch between the patient's expectations from treatments and what we as doctor can offer to patients. And this results that the problems of the patients, or the main complaints of the patients, are frequently not addressed sufficiently. So let's see a couple of examples of this medical refractoriness. So this is Parkinson's disease patient. Parkinson's disease is a neurodegenerative disorder characterized by an absence of dopamine in the brainstem, and this leads to an abnormal activity within the motor circuits of the brain, and this clinically translates to muscle stiffness and a deterioration of the quality of life of the patient. So in the upper part of the slide, if it now works, yeah, you see how a patient, a Parkinson patient looks like. So these movements are almost impossible to be carried out by him. So I command the patient to stand up. It's almost impossible to him. It takes a lot of time to perform a very simple task such as this, or just to walk in a straight line. This is how the patient looked like before the surgery was performed. This patient was managed by our team, and then we did a deep brain stimulation procedure. And in the bottom of the slide, you see the situation after surgery. I am commanding him to stand up. So there is an improvement. And also on the gait pattern. But improvement-wise, you would say, I mean, this is more than enough as an outcome. But it turns out that it is not. Because how I see the situation in patients is that the problem before a treatment, not just surgery, is that big. After the treatment, it becomes that small. But over time, it becomes their 100%. And then the patient was highly, highly disabled because of anxiety, sleep disorders, voice complaints, and these cannot be solved by surgery, nor by medical treatments. So this patient is a very good example of a fact that the medical cannabis movement, as per se, is a patient-driven one. It's not driven by doctors in most countries. So these patients self-medicated with cannabis products, and his anxiety, his sleep, and abnormal movements called collectively dystonia disappeared in this patient. So this patient is nowadays highly functional because of a combination of treatments, not just cannabis, not just surgery, not just dopaminergic therapy, but a combination thereof. So we can talk also about pain, in which the lack of effectiveness of treatments could be as low as 10% if they go to a pain clinic, and up to 40% if the patient goes to a single doctor. Then the disability measurement. Again, there is a mismatch between what patients expect to improve, that could be anxiety, sleep disorders linked to the pain or the chronic pain, or primary or secondary gains, which mean that the patient's really main complaint is not the pain itself, but it is maybe the way they want to go to a pension, they don't want to work again, and these are the so-called primary and secondary gains. So they have additional options, such as you see from the invasive side, the medical side, but patients nowadays have also the options of being treated with cannabis products with very good results. So recently we launched a study in Colombian patients with various chronic pain disorders. We can talk a little bit more about that in a while. So there are a lot of examples, successful examples, in which cannabis products could be an alternative for refractory patients, such as in epilepsy. This disease leads to a severe handicap in some patients, most of all in patients with Dravet and Lennox-Gastaut syndrome, which has developmental disorders in which the patients might suffer from as little as 1 to 100, several hundreds of epileptic fits every day. So this is highly disabling and life-threatening too. So by offering some of these patients, in selected patients, cannabis products, you can get a dramatic improvement. More than breakthroughs, other areas of interest in cannabis research is diabetes, which by certain ongoing studies is showing a trend for improvement on the levels of glycemia in the patients. In oncology, too, we have seen some promising results by using as an add-on therapy to chemotherapy, radiotherapy in some patients with malignant tumors, such as brain tumors, the glioblastoma multiforme, which is one of the most malignant tumors in the whole body, and patients with leukemia. So it doesn't mean that cannabis products could be a mainstay therapy, but as an add-on therapy, they could help the patient's quality of life and survival rates. We have to wait for definite results on that. There is also a lot of interest in Alzheimer's disease and then in opioid abuse reduction, because as many of us know, it's possible to reduce the dosages of opioids by adding cannabis products in patients with chronic pains. And the list goes on and on and on and on. And I want to finish this part by just briefly mentioning that a breakthrough for animals, for our furry friends, is the veterinarian use that is also here to stay. So what we are doing at the cannabis clinics is that we are educating our doctors. Education is a mainstay for responsible prescription of cannabis. And we also have to bear in mind that the cannabis prescription is just a prescription per se, but the patient has to receive a set of services with follow-up calls, interconsultations with another doctors and specialties when needed. But it is not just a bespoke prescription what the patient should get. I totally agree with an attendant to the meeting mentioning that we need more evidence, and we recently launched a series of 4 studies for pain, epilepsy, Parkinson's disease, and other disorders at our clinics, and we expect to have results very soon. So to finish, the previous slide, please. Just to finish, I want to tell you a very small story on myself, and it is why a successful entrepreneur would shift and embrace the idea of being absorbed by such an industry is because I acknowledge that the current treatments we have serious limitations for when it comes to offer effective treatments because we needed the platform of patients that we have at Islands to provide with the medical evidence that is needed, and most of all because the values of Chiron and the values of Islands match all together, mostly because we all think at both companies that patients should come first. So thank you very much for your attention.
Thank you, Dr. Espinoza.